Kingsbury. We're the Kansas City Pain and Health Institute. First of all, I want to congratulate you on finding us. Most people, by the time they get to me, have been to 20 other doctors, they've tried everything, and quite honestly, a lot of them have given hope on getting help with their chronic conditions, and that's the type of patients we specialize in. I have patients fly in from Europe, Australia, South America, and all over the United States, and the reason is we get results with the patients that a lot of other doctors have given up on, so congratulations on finding us, you're finally in the right place. I actually started the Kansas City Pain and Health Institute with a vision of helping the patients nobody else could help. Whether that was someone that's suffered with thyroid for 20 years and hasn't been given any relief from the symptoms even though they've been told their labs are normal, whether it's someone that sprained their ankle 10 years ago and still can't play competitive soccer anymore, whether you're a high school athlete on scholarship in danger of losing it because no one's getting your knee fixed, or someone with peripheral neuropathy, which is a much more dangerous condition because of the balance issues that's been told nobody can help you, go home, take all these drugs and hope for the best. So we started this institute to help those people which everyone else has kind of given up on and given up hope on. And we have great results with patients like that. Now we also see a lot of patients that just bent over funny and hurt their back. They've got just your normal everyday injuries, but it's those chronic people that have been in pain for 20 years that nobody can help. Our goal here is to get you out doing those activities that give you joy again. So many patients come in and they don't want to run a marathon, they just want to play with their grandkids. Or they don't want to be in a competitive sport, they just want to be able to go to Costco and walk on cement for 3 hours and do Christmas shopping. So we want to give people back those events that add the joy to their lives, the everyday things that we all do and take for granted that when you lose, just take the joy out of being here. So we started this institute to give those people hope and to get them back the life that they want. So most of my patients have been told with peripheral neuropathy that there's no cure, they have to live with the pain, and so they go home with drugs hoping that that takes the edge off. And at the end of the day, they're still in pain, and now they're playing Russian roulette with drugs. They're just throwing the next one in the chamber and hoping it helps them before it kills them. So basically, there's hope for peripheral neuropathy. The reason people don't think you can cure it is they don't understand what causes it. Fixing something's easy if you know what broke it in the first place. With neuropathy, we know for sure, we know that lack of blood flow doesn't feed the nerves, and it's just like a tree not getting water, the leaves are going to fall off and die. That's what's happening with your nerves with blood flow. So high blood sugar, all these different things that interfere with blood flow are going to interfere with nerve supply. It's pretty straightforward. So knowing that, if you want to fix it, you have to fix blood supply. You have to get out of the system what stopped blood flow in the first place. The other problem that we see with neuropathy is chemicals kill nerves. That's why chemotherapy is great at killing cancer, but it's also great at killing large diameter nerves. So if you've had chemotherapy and now you have neuropathy in your feet, neuropathy is from toxins. So chemotherapy kills nerves, it kills cancer. If you want to rebuild the nerves, first you got to clean up the system. Then there's specific ways that we know for sure can help rebuild those nerves and rebuild the damage. So once we narrow down, is it blood flow, is it chemical toxicity, is it high levels of inflammation, then we address each of those individually. That's why we get such good results with peripheral neuropathy. We have 80 to 85% success rate with a condition that most doctors tell you is not curable. And the reason is we know what causes it, so we know how to fix it. So if those are things you're suffering with, we do know how to reverse that. And it's not with drugs, it's not with surgery. There's great natural approaches that we can use to get the nerve function back and to get your life back. The way that I got into treating knee injuries, or actually knee pain, now we see patients with anything from an actual acute injury or someone that's 80 years old and is walking with a cane and has just had unexplained knee pain for years. But I got into that by working with professional athletes, and what I realized, I actually go all over the world fixing knees, and the reason I get good results is most knee injuries start out as a neurological problem and eventually turn into a structural problem. Everybody else is just treating it as a structural problem, and you just can't fix a neurological problem with a structural intervention. And what I mean by that is most of the time you don't see torn ligaments and torn structures in the body after a sports injury, but they still get treated as if you do. So somebody sprains their ankle, rarely do we actually see on an MRI an actual torn structure. We just see a lot of inflammation and we see a huge response on the body's part, but yet we still put that in a splint, we put ice on it, we tell you to elevate it, stuff we've known for 10 years hasn't worked, and we send you home and make you not compete for 2 weeks, and then the first time you come back, you blow out your ankle again because nobody fixed it. When you sprain your ankle, it's a neurological injury. The minute you feel that pain, the part of your body that responds to pain, which is the reptilian brain, completely goes into shutdown mode, and it shuts everything down. So if you were a caveman and you sprained your ankle, your brain wants you to keep up with the tribe because you're either going to starve to death in the winter or get eaten by a saber-toothed tiger. So the way that happens is your ankle swells, it gets huge, but that allows you to put weight on it, and you get to hobble along with the tribe and you don't die. Well, if you're a professional athlete, you don't have time for all that to slowly resolve if it ever does. So neurologically, we know we can turn those mechanisms off instantly, and I have people that come in on crutches consistently with a sprained ankle and walk out carrying them. Because all we have to do is turn the neurology back on and tell the brain that it's okay, our life isn't being threatened, and you can go back to normal. Knee injuries are the same way, shoulder injuries are the same way. They all start as a neurological response to the trauma, and then people start treating it structurally with ice, which doesn't address the neurology, and you never get a long-term fix. So our approach to sports injuries is we fix the neurology, we retrain the brain, we stop the brain from acting in panic mode and make it actually do things logically. Then when all that's done, we still have to go in and clear up whatever damage was there, but the real loss of performance comes from the neurological response to the trauma, not the actual trauma.
My name is Wendy Petrak, and I came to Dr. Kingsbury's office out of desperation. I think it was like my last straw. You know, I had been many years trying different forms of care to alleviate extreme pain caused by nerve damage in my shoulders. I had a bulging disc in my neck and bone spurs, and so I had all this pain. And after years of this pain that was never ending, I also got fibromyalgia, and so then I had even more pain. And after years of that pain and fibromyalgia, I was getting to the point where I felt like I would have to quit my job and go on disability. I was so uncomfortable. Couldn't cook, and my head never felt good. I felt like I had brain fog and too much pain, and just was beginning to really shut down in every way, both emotionally and physically. So I heard about Dr. Kingsbury, to what he does with the brain, and I don't know how to explain it, but with the help of my daughter, we signed up, and I started doing his protocol.
The neurofeedback?
Neurofeedback, that's what it is, neurofeedback, along with a little bit of physical therapy occasionally. And I in the beginning, I felt like I was really fatigued, probably didn't really feel like, I wasn't sure if it was going to work. I felt tired after each session, and then after about maybe 4 or more sessions, I started to really feel a lot more comfortable, a lot more alive, a lot more hope. And I continued, and I thought, this is great, this is good, this is great, but then I also felt skeptical, I guess, because I really figured it would go away, that it would be a temporary fix, just like the acupuncture and the chiropractic and all the nutritional stuff I tried, and the pain management classes and the prednisone, and just years and years of many different types of ways trying to learn how to get the pain manageable. So I was told that it would be more than manageable, that it would go away, and it did. So I think I went through like 7 months or so, twice a week, sometimes 3 times a week, of his care, and it's been probably 6 or 7 months since I haven't come in, and I've continued to improve. I'm pain-free. I am pain-free, and yet nothing's changed. I mean, I never had any operations for the shoulders or the neck, the bulging disc, the fibromyalgia. it kind of acts up a little tiny bit, but it's not nearly what I used to be when I have a flare-up. I'm somewhat aware of some soreness in my joints, which is kind of common. I have arthritis, but everything is so much more manageable, and that nerve pain is gone, and that's what was really, really just it was really, my quality of life is very poor. So, thank you, Dr. Kingsbury, so much, truly. And thank you, Nicole, my daughter, who helped me with this. So I really appreciate it.
That's wonderful.
And that's it. That's my story.
My name is Michael Smythe.
Great. And I understand you're a patient of Dr. Kingsbury?
I am.
Okay, great. Can you tell me a little bit about what your knee was like before seeing Dr. Kingsbury?
Yeah, my knee was pretty shot. It was, I was kind of at the end of the road. I had my cartilage removed in 1980 before they realized that wasn't the thing to do. It was a sports injury, and I was able to function at a high level even after that for probably 15, maybe even 20 years until I was in my late 30s, early 40s. Then it started to just degenerate. I had major atrophy of the left leg as a result of the knee, bone on bone. Started to develop some knock knee positioning on the left leg. And it got to the point where it was difficult for me to walk more than a quarter of a mile. Lo and behold, I found Dr. Kingsbury, and I've been coming here for 3 years. He's been basically working on my leg, working on my knees, my left knee, and I'm doing great. I'm mountain biking again. I can walk long distances. I can hike up to 5 miles. It's been pretty miraculous.
Okay, great. And so overall, how would you describe your experience with Dr. Kingsbury? I know you touched on it a little bit.
It's been great. He's easy to work with. I'm a busy guy. He gets me in and out of here really quickly. He ascertains what I'm dealing with every session I have with him. It's been great.
Wonderful.
Yeah.
Okay, thank you very much, Michael.